COVID-19. Right now, we have Dr. Ajay Kumar, the Chief Clinical Officer at Hartford HealthCare, joining us via Skype. Thanks so much for joining us this morning.
It's my pleasure.
First of all, I think we just want to ask, the president saying he feels good at this time and the First Lady for saying that they feel good. What are the chances they might not have any symptoms at this time?
Well, let me start with, wishing the best for President and the First Lady. This is obviously concerning that both of them have infection. I wish them speedy recovery and obviously a quick recovery if possible. There's a good possibility the President and First Lady may not have any symptoms. We see a fair amount of patients actually who do not actually have symptoms through the whole entire disease cycle. It's a little too early to say. Generally, the symptoms may take, 2 or 3 days before they can show up. So I think we will learn more as time goes by. But I wish them the best.
I also want to ask you about the time delay from the point, and of course you cannot speak to the President and the First Lady's specific case, but talking in generalities, the range of time from the point a person is first exposed to SARS-CoV-2 to the point that there's enough of it in their body and their nasal passages to test positive on a test. What is generally that time frame like?
Yeah, what we describe as an incubation period could be up to 14 days. So it could have been any time in the last 14 days the president might have been infected. Generally, we see the peak of a number of patients actually who turn out positive is around 5 to 7 days. It's anybody's guess at the moment that infection might have occurred. But obviously, the president has been very active. He has been in the different venues, and it might have been exposed to somebody within the White House staff and itself. I think we will never know. We probably will never know exact time frame on that side.
And can you also talk about the overlap? There's one thing to talk about the time from exposure to the time that you've got enough in you to test positive. What about the time from the point where you are exposed to the time where you tend to show symptoms? In other words, how many more days might we have to wait to see if the President and First Lady do show symptoms before we have a reasonable idea that they might be in the clear?
Yeah, this is a very difficult question to answer. The patients have really expressed the symptoms in a very different ways. Generally, we like to think if about 5 to 7 days have passed by, our course would be reasonably good. In the early stages, in March and April, we saw several patients who had a very mild symptom initially and continue to seem to do well for a period of time, and then suddenly between somewhere around 7 to 9th days and close to 10 days sometimes, they had a sudden change in symptomology and they became either very sick or they improved. And that behavior we've also noticed in some of the patients.
Yeah, we know that the president's one of the top advisors has tested positive, Hope Hicks, and she has said that she had symptoms and she started feeling them while she was on the plane ride back from a rally. Now, I know you said you've seen a wide range of how people are dealing with COVID-19, but is that real? Have you seen that wide of a range where some people have no symptoms at all and some people who have had contact with each other have bad symptoms?
Yeah, yes. There are several patients actually who have no symptoms at all, actually, and they turned out positive and they continue to live through the disease. The risk, obviously, is here, which is more important, is patients' age, the president's age. We've seen individuals between 70 and 75 range have significantly high mortality and unfortunately, so in the United States, in our experience of 148,000 patients listed on the CDC website, close to 21%. It's an alarming number. 21% of 148,000 mortality have been in the range of 70 to 74%. Globally, when we look at the numbers, our mortalities in this range between 17 and 79 is about 5.6 to 6%. So this is a very high-risk group, and generally males have a high mortality and they do poor compared to the females, and obviously the underlying conditions contribute to that as well. So President falls into the risk of a high-risk individual at this time, given all the characteristics I just talked about and certain relation to the weight in itself. We don't understand the reasons for that. We know this is association we have seen through the variety of studies.
The president, 74 years old. What have you seen? Obviously, he's in the high risk, but what have you seen from the older population? There are still quite a number of people who survive this that are in that age group. Correct?
That is right. That is right. The unpredictability of this disease and the virus is still baffling, and we've seen many patients actually who recover. And that's where I'm resting my hope here is that the president will come out very well out of this disease. But yes, many patients, even older, have recovered as well.
Yeah. Dr. Kumar, I think just a minute ago you gave us basically a percentage of all the people within his age range. What percentage of them go on to die? Do you happen to know, off the top of your head, what percentage of people infected in his age range, or at least percentage of people who are known to be infected, what percentage of them wind up requiring hospitalization? Also, do you know what percentage of them with known infections wind up showing symptoms?
I do not know the numbers exactly. I can give you some of the numbers which might indicate some of the details on that part. So what we have seen in the United States out of the studies which has been published, the data which has been published, out of 5.3 million individuals who got tested positive, we had about 400,000 individuals were in this age range. And obviously, we've seen the mortality as well high in that range as well. We've had in our experience in the United States, out of 148,000 initial count, 21.1% of patients did not make it in that group. And obviously, for First Lady range, which is about, I believe she's about 49 or 50-year-old, it's close to around 15% of individuals to have not made it as well. So the risk is higher. The risk actually exponentially goes up as the age goes higher. So it's a concerning scenario where we are right now.
Does this coincide with symptoms? Those who were older and did not have as many symptoms were the ones who survived, and those who had severe symptoms might have been the ones who unfortunately did not?
Yeah, without a doubt. I think the symptoms and severity of symptoms does indicate how individual bodies reacting to the disease or the virus at the time. And lack of symptoms is a very positive outcome. The recent data which is coming out, which is also pointing out that many of the individuals who have remained asymptomatic or have milder symptoms have had ongoing prolonged illness because of the virus as well. So I'm concerned about not just the immediate recovery at this time, but the long-term effect on the President's health and First Lady's health as well. This is a very difficult situation we're dealing with this virus, and we still so much to learn. And I think this is one stark reminder to all of us that wearing a mask, protecting yourself, social distancing are very important as we go forward. And I've been somewhat concerned, at least the best we can understand from media reports, that President and his staff has not been wearing a mask, at least what's been aired on the news channels, and it is concerning. So I'm hoping that everyone takes precautions and take this virus seriously.
Well, Dr. Kumar, thank you so much for taking the time to join us on short notice on this very momentous day. We do appreciate you sharing your knowledge.